Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about cardiovascular health, Alzheimer's disease, and the effects of pregnancy on heart health. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Here we are, 2018, and heart disease is still the #1 killer of men and women in this country. Kind of hard to digest, but there are so many efforts going on in our community around the country to make a big dent in that. My guests know that all too well. They know the facts, the figures, the whole picture that we're looking at in Middle Tennessee. Welcome to both of you, Denise Costanza and Ted Cornelius. Glad to have you both here.
Thank you. Thank you.
Okay, so tell us a little bit about your organizations and your mission, really, to change the face of heart disease in our community. Either one of you want to start? Ladies first, or
Sure. So I'm with the American Heart and American Stroke Association. Our mission is to reduce cardiovascular disease and stroke and the deaths that occur from that. We are involved in a couple different major ways within our community. And so locally, we try to meet people where they are. So that could be in a faith-based setting, through their employers, through the clinical setting, and we have a wide variety of programs that really try to tackle cardiovascular disease through a multitude of ways.
And where people are, I like that, you know, targeting those communities, going to where people need you. Okay, Ted, you're with the Y, the Middle Tennessee Y. Tell us about how your organization fits into this initiative, this plan.
Yeah, so the Y is for a healthier living for all. And so that means that we are very intentional about how we go about doing that. So we do it through examples. You know, we offer physical activity opportunities for many of the communities, but not just that, we are also very targeted in some of our programming related to some of the chronic illnesses that are facing Nashville and beyond. So for example, like with Denise, they're very focused on heart health. We're partnering with Heart to also address some of the heart conditions in Nashville and really believe that there's a systemic approach that's going to be very supportive to patient care. But it doesn't limit it from here. It also includes a lot of the healthcare physicians and others to get involved with this. And then we also do it through addressing other chronic diseases like diabetes. So we have a YMCA's diabetes prevention program that also works with clinicians and physicians and other community organizations.
Because, for example, diabetes has a lot to do with heart disease. I mean, if you're diabetic, the likelihood of having heart disease is a lot more likely, a lot stronger.
That's right.
Right, the odds. So, Denise, what is the status of heart health here in Nashville?
Yeah, so unfortunately, we're looking at about one in every 2 Nashvillians having high blood pressure, and only about half of that number have it under control. Nearly 1 in 5 are smoking, 1 in 3 have high cholesterol and are overweight. And so we're facing quite an instrumental and kind of epidemic proportion of health disparities in our community.
In 2018, that's what I can't get over. Is that in all ages? Is that more in the older population in Nashville and Middle Tennessee?
Unfortunately, it really runs the gamut, and depending on what risk factor you're looking at, it can affect different populations. But across the board, there are risk factors from infancy all the way to the older and stages of life that do affect people's heart health.
All right, so Ted, what are the organizations in Nashville doing about these conditions then? So
I'll tell you, we're fortunate in Nashville. We have a very strong collaborative partnership with many organizations. So you see 2 right here, the American Heart Association and the YMCA, very strong partners. But we also have partners like Nashville Health, which is Senator Bill Frist's organization that's also addressing the conditions of Nashville and others. So it's only as much as how we partner and collaborate with others that's going to allow all of us to make the greatest impact. And so we're very intentional about seeking other partnerships, and we all feel like we can't do this by ourselves.
Absolutely not. Being intentional has a lot to do with it, doesn't it? And the collaborations, that's vital. How can we really make a dent in this and prevent heart disease from happening in the first place? Because we know once you have it, you can obviously get better and improve greatly. But to prevent it in the first place, Denise, what are the things we can be doing?
So I think the first thing that's really component is being an advocate for your own health care, really understanding what risk factors you're facing, identifying those, and making lifestyle changes to accordingly. Additionally, something that we can all do is this week happens to be CPR week in America, and one of the big things that we can do to be really great citizens is if you go to handsonlycpr.org, there you'll be able to learn how to perform hands-only CPR, and that knowledge can save lives in our community, and we can make a dent on bystander CPR rates.
The bystander, I think, I remember when I was involved with the Heart Association a long time ago on the board, but just showing us demonstrations, you know, with the model, I hate to say the dummy, but the model that was used. And I think a lot of people are afraid sometimes to get involved. So how do you educate people about that?
I mean, to me, the Heart Association offers CPR training and other different training that gives people the confidence so that when an episode does happen, you have confidence going in knowing that you are able to supply some level of care. Denise can probably talk a little bit more about that.
And on that note, what are some of the, as far as the first signs of heart disease? You know, it's not always the crushing chest pain, especially for women. Kind of go over some of the symptoms.
Yeah, so the most crucial factor would be really talking to your healthcare professional to understand risk factors and how that may portray to you. For example, different forms of cardiovascular disease can affect people differently. Signs of a stroke can vary, and so really understanding what your risk factors are and having that conversation with your healthcare provider are important, but looking at some key risk factors. So for example, do you have high cholesterol? Is there a history of heart disease in your family? Are you smoking? Are you eating appropriately? Are you having too much sodium in your diet? These are all different aspects that you can modify before you experience a cardiovascular incident.
And we know the one risk factor we can't do anything about is what you've inherited, what's in the genes, but by modifying all these other lifestyle habits, or if you will, and weight and controlling other things can make a big difference. Okay, so tell us about resources then for the person watching saying, you know, I think I need to explore this a little bit or discuss this with my dad or my mom or my spouse.
Yeah.
What resources do people have in Middle Tennessee?
Yeah, so one thing we did last month was we brought together businesses, healthcare, a lot of different organizations. We did a partnership with Heart Association, Nashville Health around a summit that brought a lot of these support systems together to talk about what can we do more in order to be able to help support Nashville for some of these different things. So, you know, with the why, some of those programs that I talked about to reduce some of that risk. There's also programs through American Heart Association that are outstanding. But again, really us coming together and really continuing to hear from the patients is what is most supportive, and then us responding to that is really our best support.
All right, well, we appreciate you giving us your time coming in. We know several websites folks may want to check out, heart.org, www.heart.org, and www.ymcamidtennessee.org, midtn.org, to get a lot more information. Thank you so much for coming in.
Yeah, thanks for having us.
And we'll be right back.